Ms. Ostrom, tell me about your interaction with the healthcare system here in Houston.
I have a lot of stories beginning in 1999 when I nursed my husband through a heart attack and surgery. After that, a good 10 years taking care of my elderly parents. I've seen everything. In 2009, my husband was a patient at MD Anderson with stage 4 lymphoma. My doctor said that I'd put off getting checked, that there was a spot on my pancreas and I had to have an MRI immediately. When I tried to get one the next day, they wanted me to pay in full $4,200, and I complained and said, no, I have Blue Cross Blue Shield. I pay a fortune for
You
this.
had insurance.
Right. Yes, and they said, no, you haven't met your deductible. And I said, wait, my husband, we spend more money than we earn on health care because he's so sick. How can that be? Well, that's his. That's not yours. Well, I found it full of loopholes. They wanted $4,200 from me for something that I had to have immediately. And when I went to my congressman, I was very unhappy.
Who was your congressman?
Pete Olson. And the congressman before him had been very responsive and had helped me with students at the Fort Bend, the Literacy Council, Fort Bend County, had been wonderfully responsive. His office, when I went in there and asked them if they, since they were fighting the health care bill, what did they suggest? What are they doing for their constituents? Could he help me with that? And they said, no, they couldn't. I didn't like it that they have a big screen TV in their lobby blasting Fox News. I don't think they needed to be any viewpoint. They need to be blasting in my paid representative's office. After that, anyway, after $4,200, the place called me back and said, well, you're entitled to the lower amount because you have Blue Cross Blue Shield. Even though you haven't met your deductible, they have a contracted rate, which is much lower. That's only $2,400. So really, you only have to pay $2,400. Blue Cross Blue Shield called me back and said they found one for $1,900. My doctor's nurse found one for $1,700. I found one. I had to drive 50 miles, but I did it, and I got one for $575. Talked to the doctors in Los Angeles and asked them to please give me the results the next morning. I could not wait. This was serious. So it could be done, but that let me know how many people, when you have something on your pancreas, you can't wait 5 minutes.
I mean, you did a lot of legwork.
Right, and I had to be done, and my husband was waiting for me in the hospital. I couldn't have him worrying about this. This had to get done, and I'd paid a fortune for all of this insurance already, and the profit needs to be out of it. And by the way, when I was on my way the next day to go get it early in the morning when I was driving, I got a phone call from Blue Cross Blue Shield telling me that they had reviewed it and that they were going to give me $50 towards the procedure. I did not. My husband was very sick and needed insurance, so I could not tell him choke on it.